Former President Joe Biden diagnosed with aggressive metastatic cancer. In a stunning development, former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has already spread to his bones. The 82-year-old's personal office announced the diagnosis yesterday, revealing the cancer was discovered after Biden experienced increasing urinary symptoms, leading to the finding of a prostate nodule during a recent physical examination. The diagnosis, confirmed on Friday, revealed a Gleason score of 9, grade group 5 prostate cancer with bone metastasis. For those unfamiliar with these medical terms, this classification represents one of the most aggressive forms of prostate cancer. The Gleason scoring system ranges from 6 to 10, with Biden's 9 indicating cancerous cells that look highly abnormal and are likely to grow quickly. Despite the severity of this diagnosis, there is one potentially positive factor. Biden's cancer appears to be hormone-sensitive, which his office notes allows for effective management despite its aggressive nature. This characteristic means that treatments designed to reduce or block male hormones could potentially slow the cancer's progression. For an 82-year-old with metastatic prostate cancer of this grade, the outlook is challenging. Medical studies indicate the median survival rate for this condition ranges from 2.5 to 4 years, though individual cases can vary widely. When prostate cancer spreads to the bone, as in Biden's case, it significantly impacts both prognosis and treatment approaches. Patients with bone metastasis generally face lower survival rates compared to those whose cancer remains localized. Treatment for Biden's condition will likely involve hormone therapy, also known as androgen deprivation therapy, which decreases hormone levels to slow cancer growth. Modern treatment approaches often combine hormone therapy with additional interventions such as radiation, chemotherapy, and specific treatments targeting bone metastases. Biden and his family are currently reviewing these options with his medical team. There's a deeply personal dimension to this diagnosis. Throughout his presidency, Biden was a passionate advocate for cancer research, spearheading the Cancer Moonshot Initiative, which aimed to accelerate progress in cancer prevention, detection, and treatment. This advocacy wasn't just political, it was deeply personal for Biden, who lost his son Beau to brain cancer in 2015. Under Biden's leadership, his administration implemented over 125 new government actions and secured commitments from more than 250 organizations to advance cancer research and patient care. This isn't Biden's first encounter with cancer. In 2023, while still serving as president, he underwent the removal of a skin lesion identified as basal cell carcinoma. At that time, Dr. Kevin O'Connor, the White House physician, confirmed the cancerous tissue was successfully removed with no additional treatment necessary. However, this new diagnosis represents a far more serious health challenge. For an 82-year-old patient, the medical team must carefully balance treatment efficacy with quality of life considerations. Any treatment approach will need to account for Biden's age, overall health status, potential other health conditions, and his ability to tolerate different treatment regimens. The goal typically focuses on extending survival while maintaining the best possible quality of life. Some might wonder if this diagnosis could be related to the cognitive concerns that surrounded Biden during his presidency. While prostate cancer can metastasize to the brain in rare cases, potentially causing cognitive symptoms, there's currently no indication this has occurred in Biden's case. His office hasn't released information about whether brain scans have been conducted, but most medical experts would consider these as separate health issues. Had Biden not stepped down from seeking re-election earlier this year, this diagnosis would have created a significant constitutional situation. Given the severity of his condition and the treatments required, it's unlikely he would have been able to complete even the first year of another term. This reality underscores the complexity of age and health in our highest office. Politics aside, cancer affects people across all partisan lines. It's a relentless disease that impacts millions of Americans each year. Biden's diagnosis serves as a reminder of cancer's indiscriminate nature and the importance of regular screenings, especially for men over 50 who face increased prostate cancer risk. As Biden faces this serious health challenge, many will be watching to see if advances in cancer treatment, some catalyzed by his own initiatives, might contribute to more favorable outcomes in his case. Treatment decisions will be deeply personal, balancing survival extension with quality of life considerations. It's a sobering reminder that behind political figures are human beings facing the same health challenges as ordinary Americans. As Biden begins this difficult journey, what are your thoughts on how public figures should handle serious health diagnoses? Should they maintain privacy? Or does their public role create an obligation for transparency? For now, Biden and his family are reviewing treatment options with his physicians, navigating difficult decisions that millions of American families unfortunately understand all too well.